Do you struggle with headaches and been told you have tension headaches? Have you wondered if chiropractic care can be of benefit for you and can help you? Don't worry, you're not alone. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with headaches for over 2 decades now. Please remember, these videos are not a substitute for professional chiropractic or medical advice, for diagnosis, or for treatment. These are strictly for educational and informational purposes only. Now, these two types of headaches, cervicogenic headaches and tension type headaches, are very similar and can appear to be somewhat the same, but yet they're a little different. The reason is that cervicogenic headaches is sometimes called a neck-generated headache and is called a secondary headache. And it means that the pain in the head is felt secondary to problems in the neck. Tension type headaches are primary headaches. We don't really know what they are secondary to. However, sometimes tension type headaches are associated with neck symptoms. Now, when it comes to the actual pain that patients report, and realize if you look back at some of the other videos we talked about this, a lot of headaches are classified based on what the patient tells us. When it comes to tension type headaches, patients will oftentimes describe it as a tight hat band that goes around. So imagine putting a hat on where the hat band is too tight. So it's this tight, constrictive, compressive sensation. You know, neck-generated headaches or cervicogenic headaches can also be on both sides, but oftentimes we'll see that they're unilateral, meaning like they're on one side. So they might be on my right side, or they might be on the left side, or they might be right on the forehead. So there's that overlap, but there's oftentimes associated some neck symptoms with that. Now, interestingly enough, oftentimes neck-caused headaches or neck-generated headaches, exercise and activity will provoke the headache. When it comes to tension headaches, activity does not seem to provoke the headaches as much. So that is one of the key distinctions that we look at. However, both of them seem to have some sort of neck involvement or neck dysfunction. Painful joints, stiff joints, tight muscles, tender muscles, things like that. And both of them having those factors, if we treat those factors, the tight muscles, the stiff and tight joints, oftentimes we can see those headaches start to improve. So what does chiropractic treatment usually look like for neck-generated headaches or tension-type headaches? Well, first of all, we start with the joints. Chiropractic adjustments seem to be very effective, and their research supports that. The tight, tender muscles also needs to be addressed. Sometimes that can be done with massage, sometimes it can be done with acupuncture, sometimes it can be done with dry needling. Oftentimes, therapeutic exercises are also needed. Last but not least, with both of these headaches, there seems to be some benefit incorporating balance exercises. Yes, balance exercises. You know, balance exercises work really through the central nervous system, so it seems to calm that down too. In the long run, chiropractic care can be beneficial, and it varies patient to patient, person to person. So there's no guarantee that results that work for one person will work for the other. That being said, if you or anybody you know is struggling with headaches and they're not effectively managed and they're not being effectively treated, we'd be more than happy to evaluate and see if these are the headaches that we could help. You have so many different videos you could watch. I'm honored that you chose this one. Thank you so much, and I wish you all the best on your healing journey. And until we meet again, have a wonderful day.